Hi everybody, I'm Michelle Burke. I'm coming to you today from Niagara County Community College. This is in their radiologic technology practice lab. So this room is exactly what you may find going to a hospital or a clinic setting, but our students can come in here and they can practice on each other to take an x-ray. But today I'm going to show you a demonstration on how to take a hand x-ray. For this, we're going to be doing 3 different positions. The first one's going to be the PA, the second one is going to be an oblique, and the third one is going to be a lateral position. The reason that we take 3 different pictures for one body part, a lot of times we're moving the bones around to let the radiologist see different aspects of the bone in case there is a fracture or anything that they want to see. So that's the reason that we're doing a couple pictures just for the one body part. The tools that I'm going to need today to do this hand x-ray, this is our image receptor, and it allows us to record the x-ray, our x-ray tube, our shield that we're going to place on our patient for patient safety. We're going to have a script from the doctor telling us what exam was ordered. In this case, it's going to be our hand x-ray. And also, we have, in the x-ray world, we have markers. These are little plastic things with metal L or an R in them. The reason that we use these is to mark which side of the body we're using, just because you can actually take an x-ray and flip it around and it could be read as either the right hand or the left hand, just depending on how you hang it. So it's really important to let the radiologist know which hand that you'll be x-raying. So that's the purpose of these. Since today we're going to be doing a left hand, I will be using the left marker. At that point, we are going to, I have to come in and actually position my patient. So I'm going to run through everything exactly how I would out at clinic or in the hospital setting. This means I have to take an appropriate history from the patient. I'm going to ask them if there's any chance that they could be pregnant, if they're in childbearing years and their date of their last period. This is just double checking that there's no possibility of pregnancy. I'm also going to shield the person with our lead shield. All right, and I just want to let you know, today in our simulation of how to do this hand x-ray, we do not use any x-ray, just because that is, we don't want to practice on each other with using live x-ray, so therefore it's also illegal. So we won't be doing that. We just simulate how to position, and then we look at images that are correctly positioned to give you the same kind of outcome. All right, I'm going to get started now. So I'm going to bring in my patient. Hello?
Hello?
Nancy?
Yes.
Can you give me your date of birth?
Sure. 12/13/1965.
Okay. What's the reason that you're having the x-ray today?
I fell and my hand is hurting all on the top.
Okay. And when did you fall?
About 3 days ago.
Okay. Have you ever injured this hand before?
No.
Okay, great. And I see here they've ordered the left hand.
Yes.
So I'm going to have you come on over. You can have a seat right in our chair. Just going to place this on your lap.
Okay.
Great. You can go ahead and place your hand onto this plate. For the
Need my watch off?
Yes, I do.
Okay.
So for this first one, I'm going to have her place her hand flat down. This is our PA position. With our x-ray tube, I'm going to move it over the body part. Our light is showing us where the x-ray will show up. So I want light all the way around her fingers and also past her wrist bone. Okay? I'm also going to place my marker next to it in the light so it does show up on our x-ray. At this point, I'm going to stand behind our lead-lined wall to take our exposure. I will not be getting any radiation if I would to take this x-ray, just because of the wall is lined with lead, and also the glass panel that's there is lined with lead also. All right, so at this point I would take my exposure and then I'd move on to my next picture. Okay, so I'm going to move into my oblique, which I'm going to have her turn her hand, just turning it just a little bit and having her fingers rest on the image receptor. I'm turning on my light, double checking that all the light is around her fingers and also past her wrist bones. Okay, at this point, I'm going to go ahead and take my second exposure. So I'd step back behind the wall again, take my exposure, and then I come back out for my lateral picture. Okay. So this third picture, I'm going to have her turn all the way onto her side, almost like the person's doing a karate chop. We also have to fan their fingers out like they're making an OK sign, just so that the fingers are not on top of one another. And again, I'm checking the light, making sure that the light is all the way around her fingers and past her wrist bones again. At this point, I can go ahead, take the last exposure, and hopefully it would be all done. If they come out okay, I do want to show you some images that are correctly positioned, just because, like I said, we can't actually expose actual patients to radiation. So we'll step back here. Here's our first image and what it looks like. This is going to be our PA hand, our oblique hand, and our lateral hand. And you can see how the bones are changing in the different positions just to see if there is a fracture in any place. And they're open past the wrist. So, and fingers are all included in this since we are doing a hand. This is the marker that's showing up, indicating left hand. Okay, and that's it. Thank you so much, and I look forward to watching your videos.